think we'll get started. For those who don't know me, I'm Vin Kim Nguyen. I'm the co-director with Suri Moon of the Global Health Center. And I'm not sure if I'm delighted, but I am happy. I don't know how to put this, but we're going to talk about a difficult subject, so I'm not sure I can use the word delighted, to talk about hospitals under fire, lawfare, and the attack on care. I just wanted to underscore that this is not a solo event. We've organized this with Queen Mary University in London, Médecins Sans Frontières, OCG, and our own center here at the Graduate Institute for Conflict Development and Peacebuilding. So I just wanted to ask the audience, before we start, how many of you think that the humanitarian conventions prohibit attacks on hospitals? So a certain number of you believe that. How many do you think, if that is indeed the case, that it actually matters today? Okay, interesting. So, you know, obviously I'm referring to the current context, which we all know very well. So what we're doing here is going to explore the legal gaps in the humanitarian conventions that do not fully prohibit wartime attacks on healthcare facilities, in the context that we know that these attacks have not only multiplied, but are clearly being used as a strategy of war. The objective of this event is to decipher the legal language and to make it accessible to the public. So we'll start with setting the stage, a panel discussion, and an audience Q&A follows. Ellen, to my left, will moderate. Ellen is the coordinator of our platform here, our global health platform at the Institute. And for those who are online, and welcome to those who are online, who are joining us, all the speaker biographies are available on the website, ghplatform.org. So I'll hand the floor over to Ellen, and thank you for joining. Looking forward to an interesting discussion.
Thank you, Vin Kim, and without further ado, I would like to invite Martin van der Heijden to come up to set the context for everybody.
So my name is Martin van der Heijden. I'm a lawyer working independently for various UN organizations. I'm a research fellow at the Graduate Institute and a doctoral fellow at the London School of Hygiene and Tropical Medicine. So usually I work on pharmaceutical law, but this topic could not be really looked away from, because working as a humanitarian lawyer in a global health world, I did notice that somehow in global health we do not really understand the implications of humanitarian law. So increasingly, the attacks on hospitals are an important topic of discussion on the international level. And at the UN Security Council, the topic has really been discussed since 2005, 2006, with many declarations, including some eyewitnesses early this year from the WHO representative to the occupied Palestinian territories. And the message is increasingly that there is limited respect for international humanitarian law, but the narrative is also increasingly that attacks on hospitals are more systematic, and that the destruction of healthcare is becoming a goal in itself during conflict. And this is what we can also see in the reports that come out. There's multiple reports that look at the attacks on healthcare over the years. There's one by the WHO and the ICRC that uses internal data, and there's one that uses all the public data that is from the staff from the ICRC. So what you see in this report is that there's a very significant increase. There is a five-fold, maybe a bit higher increase from non-state armed groups, but the largest increase, as you can see in red, more than 1,000%, is from states. And the type of attacks that you see are quite kind of stable. There's a large amount of the attacks that are using explosives in hospitals, and these are mainly done by state actors. So the question that we have right now in global health, not looking as a humanitarian lawyer, but looking also as a global health practitioner, is international humanitarian law still protective? How do we protect our healthcare during conflict? And we see that there is currently two responses. One on the left is a drawing of the Red Cross logo on the top of a hospital in Kashmir during the escalation earlier this year of the conflict between India and Pakistan. So here you can clearly see that people still believe in the protection that the Red Cross brings and that international humanitarian law brings. And on the right, in the video, you see the People's Army of the NUG in Myanmar that has decided to keep the location of its hospitals secret, to work underground, and to work in the dark whenever they hear hospitals or helicopters coming over. Basically, practically waiving their protection under international humanitarian law because it doesn't work. So these are two extreme situations, and most of the healthcare providers, of course, are somewhere in the middle. What I did notice, and I think what we've all noticed, is that in global health, there's a very strong belief that international humanitarian law protects hospitals at all times. And this is also what Dr. Tedros tweeted after an attack on a hospital in Gaza, that any attack of healthcare facilities is a violation of international humanitarian law. But in practice, this is not the case. Hospitals are protected unless they are used to commit, outside of their humanitarian duties, acts harmful to the enemy. And on top of that, there is the principles of proportionality that is essential, that can be very broadly interpreted. Especially this acts harmful to the enemy can mean anything at this point. It can be that a fighter is in the hospital, but fighters also have to go to the hospital in order to be cared for. It can be that there is a headquarters that coordinates in the hospital. It can be a weapon depot. And recently in the attack on the Nasser hospital, Israel even mentioned that there was a camera used by the military and that was the target. So this act harmful to the enemy becomes extremely broad and very difficult to check. And as such, there is a playbook right now that states use with all kinds of different arguments that they can coin up and that they can use whenever they have attacked a hospital to deny, deflect, or justify. So option one is that they simply deny the attack. They say that somebody else did it because an aerial attack is very difficult to analyze. They can insist that the strike was a mistake, which under IHL is not very clear what the mistake really means. But it definitely has impact for the ability to prosecute them under international criminal law or criminal law. They claim that the intended target was the object nearby, so there's a lot of collateral damage. They say we struck something close to the hospital, well. Or option four, where we see increasingly, is that they accuse the opposite side of using the hospital for military reasons, and this can be expanded and very difficult to verify. And this is nothing new. Of course, we've seen this since forever, already since the Vietnam War and way before. And we see in all kinds of conflicts now that in the news, states are using different arguments to legitimize their attacks on hospitals, and that it becomes almost impossible to denounce it as long as we don't know the facts on the ground. And what we see also, I think I use the case of the Nasser hospital because it's the one that is most recent, is that states use multiple arguments. Here, for instance, they say that Netanyahu said it was a mistake. The military claimed that there was a camera. And then later, after the investigation, in which they only attacked one of the 6 attacks, they published a picture of 6 Hamas fighters that were attacked. So there's basically 3 different legitimate reasons for the attack, but no real clarity on how they did the assessment. So what we see is that there's an increasing interest in global health in these attacks, and that there's also data analysis being done in global health journals. So there's a merging of the fields. And this slide shows how close the more than 2,000-pound bombs that were dropped in Israel were close to hospitals. So you can see that there's a very strong correlation between the location of hospitals and the use of bombs heavier than 2,000 pounds. And people in global health are starting to question the current status quo. The main questions that are being asked is, should we use the word healthicide to denounce this type of attacks that are becoming more systematic, basically drawing this type of attacks into more of a criminal law type of language, as we've seen for ecocide, which has not really worked on the international level, but has worked in discourse and has worked on the national level. And another argument that we've also seen in the event that we had previously with the Global Health Center with Dr. Hassan is that attacks on healthcare are becoming part of the scorched earth tactic. So the scorched earth tactic is that you make a place so unlivable because you make it impossible to access food or water that people can no longer live there. And there is an article in International Humanitarian Law, Article 54, that looks at this type of tactic. but it does not take into account healthcare at all. So the new argument is that healthcare is a very important part of sustaining life, and that it is becoming a new element of this scorched earth tactic. So the question that we have today at the panel now is, are the Geneva Conventions still sufficient? And there's different answers that already have been given to that from the ICRC and from international humanitarian law scholars. The ICRC basically says in its current global initiative to galvanize political commitment to international humanitarian law that the Geneva Conventions as they are or should be sufficient, and that we just need to call for humanity to be upheld. That's basically part of a state attitude, and that the law as it is sufficient. But states are still using all these different arguments. We have Professor Neve Gordon, that professor with Professor Nicolas Perugini, has called for a ban. And there's discussions about what type of a ban, all attacks on hospitals, only attacks that use explosive or aerial bombings. He will expand on that. And there's Professor Marcus Sassoli that already in 2023 also wrote an article that calls for independent investigations into the targeting. But as this is currently voluntary by states, he also acknowledges in this paper that this is very complex analysis to be done, and it's only after the event. So during a conflict, as we see right now in Myanmar, in Gaza, in Sudan, it will be impossible to assess whether these attacks are actually legitimate or not. And that is what we will discuss today. That's it. Over to you for the discussion.
Thank you very much, Martin. I am delighted to be surrounded by this esteemed panel of experts. Professor Gloria Gaggioli, who is Professor and Vice Dean for Research at the University of Geneva Law Faculty, and former Director of the Geneva Academy of International Humanitarian Law and Human Rights. Professor Neve Gordon, to my left, who taught for 17 years at Ben Gurion University in Israel and is a professor of international law at Queen Mary University in London and a fellow of the British Academy of Social Sciences. Online, Esperanza, are you with us? Somewhere in the etherland? There she is.
Yes, I am with you.
Esperanza Martinez is Professor of Practice and Head of Health and Human Security at Australian National University, former Head of Health and Head of Crisis at the International Committee of the Red Cross, the ICRC, and Australian Commissioner of the Lancet Commission on Health, Conflict and Forced Displacement. She is also the co-chair of the Global Health Center's International Advisory Board here. Thank you for joining us in the evening from Australia, Esperanza. Mm-hmm. And finally, on the left, and of not least, is Tarek Bashbawad, who is the head of advocacy operations management team at Médecins Sans Frontières here in Geneva. And welcome to all of you. Myself? What? Oh. Thanks. Okay. So I'm going, the purpose today is not to have presentations from speakers, but to try and have an animated debate with interaction. So let's see if we can get it going. And Esperanza, I'm going to kick off with the first question asking to you. Are the legal frameworks of the Geneva Conventions unprotective?
Thank you very much, Ellen, for the invitation. And just cross-checking that you can hear me well.
We hear you well. Thank you.
Perfect. I think you mentioned one of my roles, which is a commissioner within the Lancet and Center for Humanitarian Health of Johns Hopkins Commission on Armed Conflict, Health and Displacement, and really looking at all these interactions that happened around health in situations of armed conflict. And the question was whether or not we have sufficient law, or the body of law is sufficient to protect civilian health. And of course, hospitals fall within that analysis, has been central to this commission. And the question is not only is IHL protected enough, international humanitarian law, but also the broader body of law, international human rights law, refugee law, domestic treaties or domestic legislation, for example. And although the report of the Commission is not out, it is very clear that we don't have an absence of legal frameworks. What we do have today is an absence of compliance. And when we look at the figures and in the presentation to kick off the conversation, we saw that the trends continue to basically grow. In 2024, according to data from Insecurity Insight, there were more than 1,000 incidents directly targeting health facilities, hospitals primarily. And this mostly by states as well. More than 80% of the attacks in 2024 in healthcare were committed by states. So what we do have really here is a situation of widespread violations, impunity or lack of compliance, and very limited enforcement. So I think we are looking at, is the question, are the Geneva Conventions, international humanitarian law protective enough? The answer is yes. What we do have is a lack of compliance or a lack of application of the law in practice.
Thank you. Okay, thank you. So just to clarify for our audience online and here in the room, when we say states, we're referring to governments. So Esperanza, why do states increasingly fail to protect healthcare facilities? Despite the international health, humanitarian laws, the obligations, are the IHL obligations just not strong enough? Are they not clear enough?
I think we are seeing a progression, erosion of and respect, erosion of application and respect for legal norms and for globally agreed norms. And it's not only happening in the health sector, but more broadly. And lack of political will. So it's the desire to basically advance military objectives disregarding of the laws that are in place. And impunity. When perpetrators attack hospitals, and there is, as we saw in the opening statements, very different explanations as to why that happened, and there are no consequences, then impunity basically prevails. But I think, Ellen, I would like to say something else here, which is we are focusing on international humanitarian law, and IHL is not the only law that governs armed conflict, and there's this misperception that is the only one that applies. In reality, international human rights law applies at all times, including in situations of armed conflict. So basically, it's not only the right to health that is protected and is universally recognized, but it's also the protection of some of the social determinants of health. For example, essential services, water, sanitation. They also remain protected under international human rights law. And we see the explanations, for example, for attacks on hospitals, really pinging onto IHL, but they might be breaching the right to health of population. They might be breaching the protections that are afforded to personnel that deliver impartial care, in this case, health personnel, and so on and so forth. So I think we need to look at the protections of hospitals and health personnel and health facilities in general within this broader legal framework, not just only IHL. Over.
Thank you very much. Tarek, from your experience managing operations for MSF, it should be on, and if we work on the assumption now based on the data presented that attacks on health facilities have increased, how is MSF dealing with this reality?
Well, concern would be a short answer. We are concerned for the health of our teams, obviously. The ability to continue providing some sense of humanity in conflict. We are concerned, obviously, about the fact that populations that are trapped in conflict zones are not able to get the basics in order to survive. So there is that existentialist threat, towards the right of life, maybe even to go further than just the right of health, if we go with that framework. But if I may, I wanted to bounce on the comments from our colleague in Australia, where there's a talk about compliance, but compliance when you have clearly an instrumentalization and a manipulation of the law that is really what we are facing today in many of the contexts in which we work. That means that actually states are justifying their attacks by using the law I think we have a larger problem than just a problem of compliance. We are seeing in places that the law is actually used to justify attacks on healthcare. And the onus today is put on practitioners, ourselves, working in hospitals in conflict zones to prove that the hospital is not used for a military purpose or is not used as a shield. Whereas it used to be that the military contemplating attacking a hospital needed to go through almost a checklist before being able to attack. Today, the onus of proof has been turned on its head. And I think this is a major problem we are facing as humanitarians in conflict zones. So how we're dealing with it, I think we probably need a little bit more research on the topic. We need to have a mobilization from maybe medical associations across the globe that this is unacceptable. And obviously, we need to influence major states so that they change a little bit their focus and really go ahead with the implementation of some of the resolutions that have been passed in the past. You know, Resolution 2286 on the protection of healthcare was passed almost 10 years ago. In May 2026, it will be its 10-year anniversary, and not much has been done. We would like to challenge as well a little bit the Swiss government. We are in Geneva today about how far they are going in remaining the guardians of IHL and actually taking into account the new realities at field level and pushing for stronger uptake of these rules, but the rules as they were meant to be. Not as they are today, as I said, being manipulated and instrumentalized for the benefit of militaries and dominant powers in their conduct of hostilities. I will leave it at that for now.
Thank you very much. Gloria, are the international humanitarian laws sufficiently protective? And if not, what can be done to change it?
Yeah, thank you very much for your question, and I think there is an alignment in the panel, because I think it's clear from an international humanitarian law perspective that the law is extremely strong, and we have to restate it very clearly. If you look at the Geneva Conventions and the additional protocols, you have very stable and strong protections of healthcare. So you have an obligation to respect and protect wounded and sick and shipwrecked. You have an obligation to respect and protect hospitals, ambulances, medical units, and so forth and so on. So what is very beautiful, if you want, in IHL is that you have actually a special protection of hospitals and healthcare. It means that it's even more protectant than a civilian house, or even schools are less protected than hospitals. So there is an increased protection of healthcare. How does it show? How do we know that there is this special protection? So not only you have an obligation not to attack, that's the obligation to respect, but you have to put in place positive obligations to protect. So for instance, you have to make sure that people will not go and loot hospitals, that you will have to ensure the security of the hospitals. In addition to that, you have the emblem, and the emblem is a special sign of the protection. Of course, hospitals are protected even without the emblem. So you don't need the emblem to be protected. Even for the pictures you showed when they go underground, they are still protected. So they don't abandon their protection. The protection follows from the mere fact that this is a hospital. Oh, this is a place where people are being taken care of. So if you want, the protections are there. Of course, IHL is always taking into account the reality of armed conflicts. And because of that, you often have rules that are not absolute. So you have exceptions. But it's a small exception, and we should not turn the rules on their head and having the exceptions being the rule. As you said, I think it's a very good point. That the problem is about misinterpretation of the law. So what is this exception about? Of course, if a hospital, for instance, is used for committing acts harmful to the enemy, and this is outside the humanitarian function of the hospital. So typically, let's say, imagine that the enemy is using the hospital to launch attacks. Then it means that there is a loss of protection because of the military use of this hospital. Right? And this is why IHL provides for this exception. Now, is the exception the problem? I don't think so, because imagine a situation where we would say all attacks on hospitals are prohibited, and in any case, it's a crime. What would be the result? The result would be that the enemy would have an incentive to use for military purposes the hospitals, and you don't want that. So the obligation to respect hospitals is not only the fact that you shall not attack hospitals, it's a very strong prohibition, but in addition to that, it's prohibited to use the hospital for military purposes. And if you want, the fact that there is an exception is a way of implementing that rule. The belligerents have an incentive not to use for military purposes a hospital because they don't want it to be attacked. So the problem is really not the rules. The problem is the misinterpretation of the rules. The fact that certain states misapply the rules. And also, as we heard from our colleague from Australia, also the problem of respect for the rules, implementation of the rules, the lack of political will, the fact that certain states are protected by very powerful other states which disregard the rules. So I think it is our duty to reinforce the dialogue around the rules, to recall their protective objectives. Thank you.
Do you have a right of reply?
Yes, in a moment. Thank you. Gloria, thank you. I'm not a lawyer. I'm a global health practitioner. For me, I don't understand the legalese language when I read it, so I rely on people to decipher it, bust it open for me, demystify it, and make sense of it to me in like reality context. When I listen to you, my feeling is that sounds good on paper, but then that's kind of all I'm left with, but. And then I think the reality goes beyond what's on the paper. Neve, do you agree with what Gloria said?
Does this work?
Yep.
So I'm going to begin with an apology that I'm going to break the alignment. I think Tarek broke the alignment, but I'm going to break it too. Let's begin with history. The first time airplanes crossed the channel from France to England, the Italian fascist regime immediately bought 12 planes and flew them over Libya, which it was colonizing, and dropped bombs from the air on the ICRC medical hospitals, the field hospitals, claiming that Libyan combatants were hiding in the hospitals. This is 1911. We are now in 2025. The law has developed, but what we have seen empirically and what Matteo showed you here, particularly after the UN resolution 2286, is that in terms of the actual attacks on hospital, every war, hospitals are attacked, medical units are attacked, and what we've been seeing in recent years is that they've been systematically attacked. Okay, so empirically we know the law is not protecting them, and what Esperanza and Gloria are telling us that the problem is not with the law, but the problem is with the compliance of the law, the fact that state parties and non-state parties either ignore the law or pervert the law in order to bomb hospitals, and the law itself is actually provides a robust protection. I think that is a false claim. I think that there's basically two major exceptions to the categorical imperative. So the law begins with the categorical imperatives. It tells you attacking hospitals is prohibited, full stop. Immediately in the same clause, it tells you, but hospitals shall not be used to shield the legitimate military target. And in the article after that, it tells you that they can be attacked if they carry out acts harmful to the enemy. And then Gloria tells us that hospitals are afforded special protections, which is a higher level of protection. And yet the special protections, you would think if someone or something or a group has special protections, then you cannot more easily attack it, okay? But the special protections collapse if a hospital carries out acts harmful to the enemy or shields a legitimate military target. Now, civilians cannot become a target if they carry out acts harmful to the enemy. They have to be directly participate in hostilities. So basically the requirement to undo this special protection, which is considered a higher threshold, is much lower than the protections a regular civilian receives. And that is a contradiction, I think, in the law. The shielding argument, we have seen how it plays out in the Gaza Strip, and it's very important to understand how it plays out. And it's played out in recent history in a similar way, but the Gaza Strip took us to another level. Shielding has become a tool of genocide. What do I mean shielding has become a tool of genocide? The claim is that there's hundreds of kilometers of tunnels under the Gaza Strip. And these tunnels, the claim is, are legitimate military targets. So anything above the target can be interpreted as a shield to the target. And if you've followed the news, what you'll see is Israel has targeted, I think, close to 800 or 600 times medical units in the Gaza Strip. And each time it has claimed that these hospitals shielded something that belongs to Hamas. Now we know, and this Tarek pointed out in terms of the investigation, we know that the vast majority of these claims are just fabrications. But what you can see is how the law is being deployed by Israel through the shielding argument, through the the acts harmful to the enemy, to basically defend and protect genocide. So the post-World War order, post-World War II order that was created to ensure a never again is now being mobilized through the law to create an again. And Israel can do that because the law lends itself to that, and because legal work is interpretive work. That is what lawyers are supposed to do. They're supposed to frame what they're looking at it and interpret the law. And Israel is interpreting the law. They claim that this is a perversion of the law. But the law tells you that if a combatant is hiding in a hospital, you can bomb it, or you can attack it, or you can, that creates the conditions that begin what would later lead to an attack. And the rules of proportionality that might limit that are completely open. Anyone can decide what is proportional and what is not. Today you kill 2 civilians for a soldier, tomorrow you kill 100 civilians for a soldier, and who can argue that that is not an adequate interpretation? So I think the law lends itself. I think part of the problem is the law. And I'll finally end with one last sentence. Let's say there are 10 combatants in a hospital. Let's say there's evidence of 10 combatants in the hospital. I say, so what? We do not attack hospital, full stop. You want, you'll wait till they come out and you attack them. You do not attack hospitals, full stop. We have to create a ban. Oh, I see there's more questions, so I'm going to stop here, but I'll argue for the ban, hopefully, in my next answer.
Tarek, and then Gloria, I see you're itching, please.
Yeah, so I...
Itching too? Good.
Esperanza as well, maybe, huh?
Good. We like poking here.
So yeah, I don't know about alignment, but as a medical humanitarian actor and an organization, for us, it should not be, for example, we should not be caught up in legal arguments and argumenting with belligerents about, whether it was right to bomb the hospitals or not. So for us, as really practitioners at field level, the complexities are a bit, as I said, more direct, because we have the lives of our patients, the lives of our staff in our hands, and we have to be able to have an environment that where all the rules are well understood by all the players, and in which we can continue to operate. Because if not, if we face attacks in which the dominant belligerent as well, and this is also let's say a collateral of the evolving nature of conflict, where today you have dominant countries and oftentimes asymmetric conflicts, right? So oftentimes you see guerrilla groups or that will hide into civilian facilities. So I think for us the important thing is that the rules cannot be bent in order to justify the unjustifiable. And I think this is something that I have a disagreement here with the view that not maybe that the law is perfect or not imperfect, but we have seen clearly an instrumentalization of the law. You call it misinterpretation. I call it willful manipulation. And the willful manipulation, using the law in order to justify attacks that kill our patients and our staff members, for us is unacceptable. So in a way, and I'll go that far, IHL as such today doesn't work. And so this is why I will disagree. It's not about the laws being perfect, in theory, or the way they're written, they're fine, and it's not about touching them, and it's all about making sure that misinterpretations are corrected, It sounds very orthodox, It's almost like a religion, and you're like, well, the people that have a different way of interpreting this law or this religion, we're going to bring them back in the right path, In Islam, people speak about that, about jihadis, I would disagree that this is a way to approach what we're facing today. We are facing military lawyers that are explaining to us that we had the right to bomb that hospital because there was a target within it, And then I will go a little bit toward Nev's point about how many people are you going to accept to kill in order to get that target, neutralized, And then we're going to start debating, as you said, 2 civilians is okay, 100 civilians is not okay. In a way, we cannot function in a world where dominant powers, belligerents that have the capacity to actually, with satellite, with video links and so on, are able to really know what's happening in a facility, in a civilian facility, to justify that they're bombing it because there's a single person within that facility is their target, and they will kill hundreds of people. I mean, going into how many civilians is it acceptable to kill? Is for us not questions that should be part of humanitarian discourse and something that is called humanitarian law. So I think we have a lot of difficulties in accepting the path in which we are being forced onto, which is a discussion between different interpretation of the law, because at the end of the day it will still be used in order to attack hospitals in which civilians pay the highest price, which for us again is unacceptable. So I would differ a little bit with the idea that either the law is perfect as it is, which is, as I said, an orthodox view, and also we are very different in our understanding from what I would call the instrumentalists, the ones that use the law to justify the unjustifiable. And yeah, it's a challenge. We need to, I think, challenge the status quo. The status quo as such is not working, and we need to find other ways to go about the provision of healthcare in conflict settings. Thanks.
Before Gloria, you provoked me to think next level, accountability, court, and we just don't see it. I mean, after the Balkans, how many government leaders have we seen in front of the international court held accountable, and how many years does that take? So that's another point I'd like to hear maybe some comment on, is the gap between calling for compliance accountability, but then when, where, how, who?
Color of the skin.
Color of the skin. Gloria.
Yes, there's a lot to say. So first, I will start with the issue of the facts. We've seen the data, the fact that there is a tendency of attacking hospitals. And therefore, we are tempted to conclude that because of that, it means that the law is not protective. Think about a comparison. If you have an increase in murder rates in a country, would you say, oh, then the law prohibiting murder is an issue? No. The problem is, how do we make sure that this law prohibiting murder is being respected by the different members of the society? So that's the first aspect about the facts.
Even if murder has exceptions, you're not allowed to murder except A, B, and C, and then you're allowed.
I will
then
get back
we
to
won't
that.
Change the law?
Yeah. I will go back to the content of IHL. The second point I would like to make is about the misinterpretation, misapplication of the law, and I fully agree that we can talk about manipulation of the law. We can, the head of the legal division of the ICSC is often saying, we are turning the law on its head because we are using the exceptions as being the rules. And this is a fundamental issue. So that, of course, we need to fight that. Of course, states and all states in the international community have the obligation to ensure respect. This means that at the political level, there needs to be some move. And definitely, we should not accept simply that the law is enough and we don't do anything about the violations. I think that we can all agree that the violations that we see under our eyes, we talked about Gaza, are egregious, and that something needs to be done. Now I turn to my third point about what does the law actually say? Is it really a special protection, or is it even less protection than the other civilian objects? And often here, I think there is a misunderstanding about this special protection. The first layer is that if a hospital, for instance, is used to commit acts harmful to the enemy outside its humanitarian function, there is a loss of protection. But before the loss of protection means that you can do anything, there is an obligation to have a warning. So you have a process. What we see in current armed conflicts is that this element is not there. So even we can derive a violation of the law based on the mere fact that those precautions that are obligatory when it comes to the protection of healthcare and hospitals are not being implemented. So that's a very important aspect to remember. In addition to that, not all acts harmful to the enemy mean that you can attack. No. It's only if the hospital is used for military purposes, is turned into a military objective. Imagine that you have a situation where you have a wounded soldier calling his commander and saying, well, this has happened during the last attack, and so forth and so on, providing information that is valuable from a military perspective. Is it an act harmful to the enemy outside the humanitarian function? Yes, maybe. Does that mean that you can attack? Of course not, because this would be totally disproportionate to attack in such a circumstance. So it's only if you have a situation where, for instance, the hospital would be turned into a military barrack, or where you know that able-bodied combatants are numerous there and are launching attacks from the hospitals, then you might consider that it's being turned into a military objective, and you have always the saving clause of the warning. So, I mean, we have to make things clear. Or, for instance, the comment about if you have wounded soldiers, then it means that it's a military objective. Of course not. I mean, hospitals are there to take care of the wounded civilians and wounded soldiers, and it remains protected irrespective. So I think that we should not pretend that the law is less protective than what it is. Then the law is never there alone. And I think if we have only that, it's impossible to protect civilians. It's a legal protection, but then the actual protection is provided by states, by the international community as a whole. The last point about accountability, of course, this is a huge issue. What do we see in terms of accountability? We see that there is difficulty to prosecute, to go after those committing war crimes, crimes against humanity, acts of genocide. We see that certain states adopt even sanctions against the International Criminal Court, and that is really an issue that we should be taken into account. Now, if I may, a last comment. If we say, okay, the law is not protective enough, okay, what kind of law would you propose? And then do you really think that any state is going to abide by rules where they would say, well, we commit never to attack hospitals in any circumstances, there is no exceptions, taking into account the fact that it will be an incentive for potential enemies to use hospitals for military purposes?
Gloria, you mentioned evacuation. How can people be evacuated from hospitals? I mean, and is there international clarity on the standards for the warnings? I mean, we've seen in just the past 10 months, 1 hour flyers being given. Is that a warning? And where are people supposed to go that's safe?
No, that's a very good point, because sometimes some belligerents said, well, we did a warning, but the warning was actually not effective. So the way the warning is being conducted has to be effective. You need to also leave sufficient time for the evacuation. In terms of planning and preparedness, you have to plan also for evacuation routes. So, I mean, there is a lot to do also on the practical level to ensure an effective protection.
So this is really expecting belligerents and states to use good behavior and have a moral compass. To me, that does not jive with the concept of war and conflict at all. But, okay. Esperanza, are you itching?
Yeah, but Ellen, at the end of the day, that's how IHL, the Geneva Conventions, were born, out of the need to put a frame to human suffering and indiscriminate, no attacks, but the lack of protection to human dignity and human health. So that's the origin of the Geneva Conventions. At the end of the day, the Geneva Conventions, international humanitarian law, was born out of the suffering in the battlefields. It was not born in peace. It was born in armed conflict, for armed conflict. But above that, we do have fundamental rights, the right to health, the right to life, the right to essential services. So I think what we are getting into today in attacks on healthcare is we're getting entangled into the weeds of the legal use and misuse, where some of the provisions in the law are interpreted by some actors as blank checks for attacks, able to attack because I have a justification that, as our colleague from MSF said, is now on the shoulders of the health practitioner to prove that that hospital was not used for military purposes. Well, all the checks are not done by the military. And we are not talking about Gaza alone, but it's the situation in Ukraine, in Sudan, in so many other different countries in the world today. So I think the issue is that if we go narrow into the rabbit hole of the law itself, we cannot find justifications to say the law as it is sufficient or is insufficient or we need a different set of laws. When in reality, if we take a step back, we really complying with humanitarian principles and the respect, for example, for impartial delivery of care. The fact that civilians and those wounded, even if they are soldiers, are protected. And we all as humanity have agreed to these principles because we committed to our very core essential principles, which means being human. So yes, Helen, you find that very difficult because we are talking about armed conflict, but at the end of the day, that's the very origin of the body of law that we are discussing here. And yes, there is no political will in the part of some very big states, many of them armed producers. But what we need moving forward is really a coalition of voices that are loud enough to demand change, to demand that hospitals not being attacked, to demand that communities that have their homes destroyed basically are not forced to move to nowhere because the rest of the territory is destroyed within an hour's warning. So all of those elements, we need a coalition of states that are willing not only to uphold the law, but to ensure that it is complied with by the other states, that involves as well those who produce the weapons and facilitate the trade of weapons, that involves civil society and communities and medical practitioners, because at this stage, we cannot just rely simply on states, many of whom are participants of these violations, to basically uphold the law moving forward. So it is, I think it's a moment where action, global action and collective action is required, and it has been done in the past. If we look, for example, at South Africa and apartheid, that was changed because the world and communities and states say enough is enough. Here, we're coming to a point, for example, ministries of foreign affairs have come out from many different countries to say attacks on humanitarian workers must cease. Yes, that's a good call, but now, so what? Is there going to be an embargo on weapons? Is it going to be a trade sanctions? What is following? So we get to a point where actually compliance happens and there are consequences for violations. Over.
Thanks. Yeah.
So I think we need to begin by overcoming some of the myths, and Esperanza here continue to circulate the myths. And some of the myths is that international law was created to reduce suffering. And there was an aspect of that, but international law is implicated in imperialism and in colonialism, and had nothing to say, hardly anything even today to say about non-state actors fighting for liberation and resistance against colonial and apartheid regimes and so forth. So international law is a state-centered law that regulates the violence among states and gives them an advantage against non-state actors. That, I think, is very clear. It's also inflected in racism and sexism and so forth, and we can get into that. But we first need to understand this law, this body of law that we're dealing with. I do want to say, though, a word or two about why I think we should adopt a ban and why we need to take the exceptions seriously. We need to take them seriously because states mobilize them to their advantage. Now, there's a consensus that chemical and biological weapons should be banned. And I think here, the four panelists will agree. I think they'll agree that anti-personal linemans should be banned. I think they'll agree that torture should be banned. And so when we're looking at the reasons why some of these topics were banned, for example, chemical and biological weapons, we say that they are indiscriminate, right? They do not discriminate between civilians and combatants. And we say that the level of harm that they produce is just mind-boggling, and we want to stop that harm. My claim is that targeting a hospital is a weapon of mass destruction, because the reverberating harm that is created, so let's say a hospital ward is attacked, not even the full hospital, it's damaged. And the only CT or MRI or X-ray, only imaging system in the hospital is hit and no longer works. Think about the lives, just that. It didn't kill anyone, it just killed the machine. Think about 1,500 doctors and health professionals have been killed in the Gaza Strip. Think about the long-term effects of that on the lives and patients in the Gaza in the next decade, 2 decades. It's a generational harm that is being created here. And the minute we leave the event and open our eyes to look forward, then we see the harm. The law does not look in that such a way, and the militaries don't look in that such a way. I'm asking you to stop looking like a state, stop seeing like a state, stop seeing like a military, stop seeing like the law. I'm asking you to start seeing like health professionals, like MSF, okay? And when you start seeing like that, then there is no attack on hospitals that will ever be proportional according to the law. Okay? And therefore, the only way forward, if we're thinking what we need tomorrow, is to just introduce a complete ban. Now, Gloria tells you that a complete ban will incentivize warring parties like Hamas to use hospitals for their advantage. Israel's telling you that Hamas every day uses hospitals to their advantage. The people that actually do the research on this, which is, for example, Insecurity Insight and so forth, and interview the non-state warring party, they say the opposite. They say that for them, the hearts and minds of the population they represent is important for them. And they will never destroy their own hospitals or use their own hospitals in a way that will lead to their destruction. Okay? So I think, again, the incentivizing argument is a state-centered argument. It's an argument, and even if it does incentivize a few, the harm of attacking is such that we cannot allow it. I'll stop there.
Thank you, Niamh. Let's look forward. Let's look forward a little bit. We have just a few minutes left. Let's look forward. Tarek, what actors could mobilize a campaign to ban hospital bombings or at least push for a meaningful accountability?
I really think that we need to get health professionals involved. So this is something that we have explored in the past at MSF to try to create coalitions with doctors' associations in different countries. I think there's always a little bit of, I don't know the word in English, bienveillance, towards doctors, that they're supposed to be for the good of the population in general. So in general, not always, but so there's, I think, if health professionals across the world, would really kind of unite around this idea of, the protection of healthcare within conflict settings and really push domestically to influence their own states, their own governments to take stronger positions. I think there's really an untapped civil movement there that could take shape around this topic and that could really get through to politicians as well. Doctors are often influential in financing political campaigns, because they have the means to do so. They often, as I said, have a good standing within societies and so on. So there's something there, I think, that we could work on, and MSF could maybe participate in such a social or civil movement towards making sure that indeed, as I said, we're not lawyers, right? So I'm not going to go into the nitty-gritty details of legal arguments and so on and so forth. I don't think that's the place for MSF, to be honest. But I think that if we carry the message of protection of healthcare in conflict, right? Let's go back to something a little bit larger than just attacks on hospital, but that within the humanity, within the worst of humanity, which is conflict and war, there is a space there. It's not only a legal space. It is also a shared humanity space, and it is something that we need to mobilize key elements of societies across the globe to recognize that importance, to recognize that it is necessary to keep that space of humanity within conflicts. And I think with a large enough coalition, we could get results at global level. Maybe not specifically on legal clauses, but at least in terms of building a consensus, a renewed consensus about how conflict, what is acceptable in conflict and what is not. And that goes beyond, for me, legal frameworks. Thanks.
Gloria, what could the academic community do to close the legal gap and/or step up enforcement of hands-off hospitals?
Thank you. That's a beautiful question. I think that it's very important to build bridges between different communities. So healthcare workers, states. I think we should not only portray states as the enemy, because I mean we count on states to implement the rules, and if there would be rules in the future, it's again for states to implement them. So I mean we have to bring together health workers with members of the armed forces, also strengthening the dialogue with organized armed groups, because they have also to implement the rules to protect hospitals. I think academics can also provide clarification around the rules. They can also participate in data collection. And here there is some hope, because in the last few years, we have more and more data being collected, also by different coalitions, about attacks on healthcare. And this allows us to have better evidence, also better understanding of the phenomenon, and perhaps in the future, when the political situation allows, there would be possibilities also to prosecute. So collecting data, collecting evidence is absolutely crucial.
And Esperanza, before we turn over to the audience Q&A, post-conflict, there is no easy replacement for health workers and facilities. As Niamh mentioned, it's a multi-generational issue. What would be needed to treat attacks on healthcare facilities as a public health issue and not just a legal issue?
It is a public issue, as Niamh said, is the fact that it really has this reverberating and long-term impacts that go beyond the immediate effect and really translate into other systems and other generations. So I think the first one is, as it was mentioned now by Claudia, is to make sure that we do insert public health concerns when we analyze the effect of attacks on civilian home. So really to have this broader concept of how the health implications for populations when hospitals and health systems in general are attacked. But I will go one step further, and I know this is controversial, and probably I'm setting here a cat among the pigeons, which is that I will argue that the protection of human health is essential for national and for regional security. Health systems that collapse, hospitals that don't work, are unable to do surveillance and unable to track patterns of disease. And therefore, health security is impaired when we have attacks on healthcare and we have health systems that don't work. And there are other ramifications in relation to populations that basically don't have adequate status of health and well-being. So this doesn't mean securitization of health. What this means is what was already mentioned here, to have health practitioners at the policy table, helping to shape policies and helping to shape the debate. And on the other hand, to have non-health practitioners and leaders who understand how their decisions are impacting health. And this element, at the end of the day, is health diplomacy. One way forward is to have discussions that incorporate the vision and the knowledge from the health sector into policy making. Because whether you like it or not, policy is made by states and by governments, and it will continue to be for the foreseeable future. So I think that element is quite important to keep in mind and to work on.
Thank you. Let's open up to the floor in the room and the floor online. Do we have a show of hands? Are there many comments, questions? Please. Oh, good, our faculty. Please, yeah, students, but please, rather than providing a lot of background context, try to go straight to your question, just to give other people space. And if you want to direct a question to a particular speaker, feel free.
Hello, my question is for Professor Niamh, but I'm opening it for the panel to answer. You suggested that there has to be a total ban on hospitals being attacked. And as the healthcare practitioner, I would completely understand, but I'm looking at it, how would you propose that it be enforced? Because the thing is that even with its weaknesses, international humanitarian law, it is a system that we've agreed to for whichever reasons, because it is based on mutuality and reciprocation. So which means that I will not attack these hospitals if you agree as state B to not attack me. So what is this system that you would propose that would make that happen?
Should we take a bunch and then, okay, Suri, then Gianluca? There was one more still. Sorry. Oh, yeah, please introduce yourselves.
Thanks
Please
very much.
introduce
My name
yourselves.
is Suri Moon. Very proud to be co-director of the Global Health Center, not because I can take any credit for this fantastic discussion, but because I'm proud of my colleagues for having pulled together in partnership with Queen Mary University and MSF. This is very, very important and timely discussion, so thank you. Sorry, longer intro than was needed. My question stems from the impression that I have. I'm not an IHL expert, but I have the impression from all of your comments that we can debate and disagree on whether the letter of the law has been violated. But there does seem to be an agreement, and this is my impression, that the spirit of the law has very much been violated. And my impression observing the events over the last several years with the wars in Ukraine and Gaza, in Sudan, we have a constant attack on international norms and rules, an erosion of international norms. And Gianluca and I were just talking about this an hour ago, that in continuously violating the spirit of the law, the value of international law overall is being eroded constantly. And I'm wondering what you think. I think this might be a question in particular for Professor Gagioli, but certainly for all of you. Do you also perceive that? Do you see a erosion, a fundamental weakening, a disrespect for international norms and law or not? But if you do, what can be done about it?
Okay, and one more. Gianluca Borgi is a professor of international law here at the Graduate Institute and revered member on the Global Health Center.
Thank you, Ellen. You'll be my biographer. Question, I guess, for Professor Gargioli and Niamh. So we all have Gaza in mind. So what is by formally as international armed conflict. What about non-international armed conflicts? I'm thinking of Syria, Sudan, Myanmar, Ethiopia, where we have ample evidence that the government has targeted hospitals, ambulances of its own people. So if the law is ineffective and kind of evanescent in international armed conflict, even more it seems for the non-international ones. Additional Protocol 2 is less ratified. So are your argument applicable also to this, or do this subset of conflict need something more to bring some humanity to fill the gaps of the law? And talking about changing the law, the development of the law, my colleague Andrew Clapham, who teaches international human rights here and IHL, has made an interesting arguments in his book on war, in other writings, in his talks. And he says, if you look at IHL, it doesn't say anywhere that it's a license to kill. It doesn't provide a positive legitimation for killing your enemy. In a way, it's all about when you cannot use it. So he makes a point, why don't we rethink the law? Not as a license to kill with exceptions, but as something where you need to justify, even going back to the justification and to burden of proof, even more the fact that you're killing somebody on a battlefield in the name of the law. I don't have the details of that, but I find it very thought-provoking, and I wonder whether, if you want to think of improving the law, that line of thinking can be promising, at least at a rhetorical level, if nothing else.
So, un, deux, trois, over to Ars, and then Daniela will field some questions from the online audience. I think you need to use this microphone, Daniela. Yeah. No, after the responses. But you could, yeah. Sure.
So regarding the enforcement of a ban, we know that that some countries just disregard international law, whatever. We know that some, it's important for them to seem like they're, what we do know we can look at what other bans have done. And we do know, for example, that the bans on chemical and biological weapons and definitely the ban on landmines have not stopped states from using these weapons, but they have reduced considerably their use and they've reduced considerably the deaths due to these weapons. So bans work, and it simplifies. A ban on attacking medical units will simplify the whole legal regime. There will not be an argument, is there a violation or isn't a violation? It's always a violation. So it makes things much simple. I think there still will be, I'm sure there'll still be sometimes problems of enforcement, but I think the evidence does suggest that it will reduce harm, and if the reduction of harm and suffering, as Esperanza said, is the objective, then I think it is today the best solution. I do want to say a word about the norms erosion. It's obvious that the norms of IHL are eroding, and it's even more obvious that the norm relating to the protection of medical units has completely eroded. Even in the wake of Resolution 2286 from a decade ago, we see how, so the question that we need to put to ourselves, and that Gloria and Esperanza and practically all the human rights and humanitarian organizations have been putting to themselves in the past several years, is how to elevate the norm. How do we re-elevate the norm? My claim is that calling for accountability to the law that relates to medical units actually undermines the norm. Okay, and that the only way to elevate the norm is through a ban. Okay, because Israel, but not only Israel, Sri Lanka, Myanmar, etc., will come and say we're abiding by the law. Of course, Gloria will disagree with them and say they're perverting the law, and I probably will agree with Gloria in many respects. But I don't think that's so important, because once we begin that debate, the norm goes down. We need to get out of that debate, and getting out of that debate is through the ban.
Thank you very much. So I'll talk about the question of the erosion of the law. I think we have all the same reactions, because we see that not only some states refer to the exceptions of the law, which is still, even if we disagree with that, it's still a discussion around a common ground. You know, it's the same vocabulary. We're talking about international law with states, we have the same vocabulary. So that's already a concern, you know, like the perversion of the interpretation of the law. There is another concern, which is potentially even greater, which is the fact that certain states, powerful states, simply disregard the law. They consider that it's not even a tool, that it's not even a vocabulary that we can use. And I think that is even more perverse, because if we don't have this common ground, what are we talking about? It's anarchy, right? So it's a tool that we have to have the law. If we completely disregard the law, we have to start everything from scratch. And based on what? I really don't know. So that is really, I think, a concern that we should have. I think that even if from a realistic perspective, I think it's difficult to imagine in the short term a total ban legally. I mean, states accepting a total ban. But I think that it's an interesting idea to pursue, perhaps to have also other means like a political commitment. Look at EWIPAs. Explosive weapons in populated areas are not as such considered as always prohibited, but there was a political commitment that was signed by a number of states, and at least we can move forward. So there are also other ways beyond the hard law to make things progress. So I would think that this could be one element to take into account. And then a question of Professor Burci regarding non-international armed conflicts. If we look at treaty law, It's true that treaty law is not very developed because we just have Common Article 3 to the 4 Geneva Conventions, Additional Protocol 2, and you're right, many states did not ratify the additional protocols. But fortunately enough, we have customary law. So it's unwritten law that is still considered as binding for all states and organized armed groups in the international community. And regarding the protection of healthcare, there is no discrepancy. So it's the same binding rules for states and non-state actors, organized armed groups in non-international armed conflicts. But that is not enough, right? Because it's a question that we discussed once together. There is a question of ownership, right? That organized armed groups, they need to feel that this is binding for them. And they did not ratify, so it might be an issue. But on that also the international community has worked. So for instance, you have organizations like Geneva Call, which developed deeds of commitment, and you have one deed of commitment that is dedicated to healthcare. So what does that mean concretely? Concretely, Geneva Call is meeting certain organized armed groups and is saying, okay, we noticed that there were issues that some hospitals have been used for military purposes, other hospitals have been bombed, and this is extremely important from a humanitarian perspective. Would you agree to sign a deed of commitment and to commit not to do these violations in the future, and we can help you with the training and so forth and so on. And a number of armed groups have signed this deed of commitment. So this creates ownership. So not only you have the law, but then you have the humanitarian engagement that is absolutely crucial to build this sense of ownership. And the last point about Professor Andrew Clapham, I think it's a very elegant, he's always elegant, it's a very elegant way, to reshape the narrative of international humanitarian law. Because, other people talk about the laws of war, the law of armed conflicts, and when you talk to militaries about IHL, international humanitarian law, we talk about the same thing, but the vocabulary might be different. So, for instance, the military are going to tell you, these are collateral damages. And the humanitarians tend to say, well, I don't like the term collateral damages. These are people who died. So you are going to talk about incidental civilian damages. But I mean, it's the same concept, simply you portray it in a different manner. And as the militaries were so much involved in the development also of humanitarian law, there is a tendency to insist on the exceptions and to say, we have the right to kill. But he's right, Clapham, that if you look at the rules, you have no rule saying, well, you can attack. It's simply saying you cannot attack civilians. So it's a body of law that is based mainly on prohibitions. So there is this interesting proposal to simply reshape the narrative under humanitarian law.
Turning to some of the online comments, there was a very nice comment posted by somebody named Tao Wen. I don't know if it's related to you, but...
We're a very small family.
Yeah, it's like every second person, yes, saying thank you for the burning discussion, and he could see, or she, sorry, could see that the online discussion was also burning. So Daniela, help us see what's burning online.
Yes, thank you, Ellen. There are 3 questions, and as you mentioned, Tao put 3 questions, but I'm going to just, in the interest of time, pick one. So first, Dr. Bhatia is asking us, what legal and diplomatic approaches can be leveraged to reduce, address, and avert attacks on healthcare facilities during conflict, once a conflict has begun? Tangai Marega is asking us, is there a better or different approach to avoid or prevent war as the solution to conflict resolution? And then Tao, I'm picking the first question that Tao is putting in the chat, how and whether the allegation of an act harmful to the enemy can be properly investigated to ensure transparency. And I stop here.
1, 2, 3, 4. Who is courageous?
I'll make a couple of comments as well on the other questions, because I think there's really something there to dig a little bit more. The rupture of norms, so I don't know if I'll speak in the name of MSF specifically here, but at least for me, we've seen things change course, deteriorate since 9/11. 9/11 made everything a dichotomy. made it, you know, no gray space anymore. It's right or wrong. You're with us, you're against us. So the whole idea of humanity in the middle, including in conflict, almost disappeared. And so that almost absolute approach towards, or at least in dealing with conflict and in dealing with health, access to healthcare in conflict, made it so much more complicated because there was no middle ground. So I really think that 9/11 and the narratives that have, you know, that came out of 9/11 are really, you know, the slippery slope that has been taking us down the rabbit hole since over the last 24 years or so. And so that's, I think, for the norms discussion, you know. Then on non-international conflict, just quickly, we have seen historically, at least in some of the places where we were present, not all the time, but often, when there is what I call existential conflicts, right? Which is maybe what you're witnessing a little bit in Gaza, or at least there's a feeling that this may be an existential conflict, talk of genocide and so on. But when, let's say, two groups are fighting each other, subnational level, and the objective almost is like the destruction of one another, then healthcare has a specific value in that destruction of the other. So health facilities will even face, you know, more attacks in that type of situation where maybe you will have two ethnic groups fighting each other, you know, not in the country to country type of classic fighting situation. On some of the questions that have been raised online, I think particularly, well, avoiding conflict, of course, nice thought process. MSF is not a Pacific or a pacifist organization per se, and I think we were born out of a reaction to, you know, the way that there was a response to conflict and the ICRC kind of, you know, confidential way of dealing with as well as atrocities and so on with different states, negotiating with states. And so there was a reaction, a global civil society, or at least in France at that time, a civil society reaction to how things were done in relation to conflict. So I think to that extent, there needs to be, again, a citizen kind of led, you know, movements in order to deal with the extension of conflicts and so on. You see that the narrative that is used in conflict often, you know, plays on things that are very touchy to people, you know, they play on their identity, whereas you know that behind conflicts often is political economy, right? Access to resources and so on. So I think if in different parts of the world there's a reaction towards being manipulated, the real reasons behind conflicts, then there might be an avenue to explore a reduction of conflict, whereas we have seen over the last 10, 15 years that number of conflicts have actually risen in comparison to, let's say, the end of the Cold War, which was a historical low for the number of conflicts in the 90s. I'll pass the floor.
Good, sounds great. I'm thinking, wow, that relies on deciphering fake news from real news. No small feat today. Who else wanted to weigh in on questions online? Oh, Esperanza. Oh, yes, Esperanza.
Yes, if you don't mind, I just would like to provide a few remarks on the questions that have been asked. And the first one is in relation to not only translating international law into domestic law. I think that is a critical one to be able to move forward towards accountability, particularly in situations of internal or non-international armed conflict. But beyond the law is also the training and the dissemination of the law among armed actors, state and non-state armed actors. Very often, and there are studies by the ICRC, the engagement with military actors and weapon bearers actually translate into a reduction in attacks. So that's an avenue that can be pursued. And the rules can be enshrined into military doctrine or can be put into operational procedures when, for example, military operations are conducted. Coming back to the issue of the ban on hospital, on attacks on hospitals, I think it's a great idea. However, in the current geopolitical climate where we cannot agree on basic principles of protection of civilians, I think it will be very, very difficult to get the states to agree or to have a sufficient mass of states and countries that could move onto a ban. So that's not to discard the idea, but to say we really need to be realistic on the fact that we are in a current climate of division and geopolitical lack of consensus, and a challenge to establish structures where potentially seeking a coalition, an agreement on something as a ban might be difficult to achieve. And one final little point is the first speaker, the first person that provided the question, mentioned the reciprocity of IHL. There is no reciprocity in IHL. So if you attack my hospital, then I will attack yours, or the other way around. If one party to a conflict violates international humanitarian law or the rules of war, it doesn't exonerate the other from upholding them. So it is non-reciprocal. So I, as a party to a conflict, must uphold the rules of war, even if the other one is not. Super difficult in practice, extremely difficult to understand, but that's one of those elements where a dissemination of the rules of war really goes a long way as to how much I should or should not do. Thank you.
We have 2 minutes left, and we have 2 comments burning.
So I'm going to end by just putting forth a question and to begin answer it. Why are hospitals and medical units attacked? That's what we first need to ask ourselves. Are they attacked because they're hiding combatants or something of the sort? I think no. I think it's fairly obvious they're not, and we see in many conflict zones that there's systematically attacks. Indeed, in Syria, they went into caves and tunnels, and the caves and tunnels were attacked. And the reason is that the 2 main reasons are that I think that these are life-saving and life-sustaining institutions that are needed both for war making, so the other side understands that they are not exactly neutral, they are important for the war making machine, and they're crucial for governance of the population, of a society. And when you want to destroy the other side, you go for their medical system because they cannot govern without a medical system. Okay, so I'll just end with that, and that increases the reason, I think, for a ban.
Yes, thank you. Yeah, to come back to what are the legal and political approaches that we could adopt, I would like to point to a project that was conducted by the ICSC some time ago, which is called Healthcare in Danger. ICSC produced a set of recommendations and collected good practices. It was really a multiple-year project. So you can have a look at the recommendations. They are very much based on what we heard about integrating the law in the domestic law, about training, also about humanitarian diplomacy. And I think that humanitarian organizations are playing a crucial role there to have this sustained dialogue with the belligerent parties. Another comment on the acts harmful to the enemy, how to evidence that there were acts harmful to the enemy, and so forth and so on. I would like to record the obligation of states to conduct independent investigations. That's a duty as soon as you have credible allegations. And so it's not for the humanitarian actors to provide evidence or for the victims to provide evidence, but it's really for the states to conduct such investigations. The international community more broadly has also a role to play when we see that a state is not able to conduct independent investigations, so we can create commissions of inquiry. The Human Rights Council has created many of them for different contexts. And also we have to see that there is a kind of democratization of the collection of evidence. Look at what's happening in Ukraine, where people, they use their mobile phone and they take pictures. And thanks to that, you have also new avenues. So for instance, you have companies like Bellingcat. So, it's basically they were investigative journalists, and they are able to use new technologies, to leverage new technologies to collect data using satellite imageries, using pictures taken from the people and then distributed on social media. So all these are tools that we can use to try to evidence and collect data about the violations. Thank you.
Thank you. Thank you to all the panelists for a very rich and I'm so happy it was kind of pokey, provocative conversation. Thank you.